Thank you, Eamon. And I know Eamon from my previous life. We worked together in the health service, but I know Eamon is a strong advocate for people in addiction service and a radical and an innovative thinker and practitioner. And I think the recommendations he set out are very clear, including one of a stronger political oversight of this key issue. So next session, we have a couple of people going to share times. But first up is Brid Walsh, and many people will know the work of the regional and local drugs and alcohol task force. And Bríd's going to give you her perspective on some of the issues for us in this assembly.
Thank you very much. Delighted to be here. This is a real piece of history, so it's a great honour, and I'm very jealous because you're hearing from some amazing speakers over the course of the few months. So I've only 7 minutes and I will stick to it. So I'm here to talk about the regional drug task forces. There's 10 of them in Ireland, and I suppose they came out of all of the really brilliant community activism that there was in Ireland to respond to the huge issue that drugs were in the country at the time, years ago. So it began with the local drug task forces in '97. There was 14 of those, 12 in Dublin, 1 in Cork City, and then 1 in Bray. And it would be 5 years then before the regional drug task forces were set up to cover the rest of Ireland and the parts of Dublin that weren't originally, I suppose, catered for in that first round of trying to really involve communities in the response. And I suppose the important thing to say about regional drug task forces is its authentic partnership. And it's not a talking shop. It's not that, we kind of do fake consultations and things like that. And this is brilliant, by the way. I'm not referring to this. It's really about equal partners making decisions. So we get a budget from the Department of Health. And you can see a load of logos up there. I probably got some of them wrong. But at every task force, each of those 10 regional task forces and the 14 locals indeed, you will have statutory partners at the table. Your HSE, your guards, and the county councils and all of those. We even let politicians join, the management committees. You will have community representatives, and that's absolutely central, and that's why I have that in the middle of that. And people with lived experience and their families, and community and voluntary organisations, and not only drug and alcohol community and voluntary organisations, youth services, everybody who knows what's happening in a particular area. We all get together, and with that budget, we start planning what needs to happen in this area that we can really make a difference in terms of reducing, the harm caused by drugs. So, and everybody has an equal voice, and that's really important to say. There's no one, statutory organisation or anything running it, if you like. There's been amazing services set up based on that particular model, based on drug task forces. You're going to hear about some of them in a moment. And they've made differences, and they've helped save lives. And it is a model that works. It's powerful when it's done properly, and when all the partners involved, it is a really, really powerful structure. So as I said, there's 10 of them in the country. So if you think about that, that's a big ask because it covers all 26 counties. So there's lots of issues with that in terms of trying to respond effectively, like transport, access to services. Some of my colleagues in the regional drug task forces have 4 counties in their area, and they might have no services at all in one of them. And we're talking about, health inequities a lot in this. That's a massive problem if you live in an area and you actually can't access a service, while there's other areas where there's proliferation of services. And that's rightfully so, and we're not saying that that's not good. But, there has to be equity of access. That's really, really important. And then in terms of diverse populations as well, we've new communities. You have really dense urban areas. You have then, rural isolation and all the challenges that come with that. So, these are the kind of challenges we're trying to grapple with all the time. And we have in there staff retention, and that's a really important thing to talk about, and I'm going to mention it now in a minute. I know some of you have been to Coolmine and to Merchants Quay, and you've seen some of the amazing work that goes on, and some of the community drugs workers that make that amazing work goes on, and they're really not valued enough in this state. And I think that if you could do one thing, that would be huge. So this is my last slide. I am going to stick within the time. And this is really about the opportunities for meaningful change. I mean, you have a wonderful opportunity here to actually really influence policy and change how we approach drug use in this country, and be allies for people who use drugs and people who are impacted by drugs, their family members and their communities. We need to end that postcode lottery for services, and the way to do that is to resource the regional areas appropriately and resource all local and regional drug task forces appropriately, because what we do works, because it involves everybody who needs to be involved. Now, to do that, you need political will. That's really important, and we know that political will is driven by public support. So that's why we really need you to be the advocates for the service users. And it's a really difficult thing to do because of stigma and all of those things that you've been hearing about from lots of other people. But you have a golden opportunity to do it here. And I don't know whether any of you are involved in your regional or local drug task force in your area, but if you're not, really, you know, after all of this finishes, go and make that effort, go and join, you know, talk to your neighbours about it, get involved, because that's the only way we're going to make a real difference. Exactly as Eamon said, you know, politicians will make changes if there's public support for those changes. So we need you. And then the last thing I will say is about the equitable terms and conditions for the workforce. And when I say the workforce, I don't just mean, you know, the project workers and the addiction counsellors. I mean the recovery champions, the peer workers, some of the people that you've met over the course of the last few months and will meet again before you finish, who give up their personal time to share their personal journeys as well. They facilitate co-production groups and all sorts of things, and they're not paid. And in terms of the community drug workers, they don't get the same conditions as their colleagues who are doing similar jobs in the state sector. And that's a real issue. And I can tell you from myself and my colleagues, we're hemorrhaging staff into the private and public sector because of that. And if we want to ramp up our services, as we should do, in line with what they did in Portugal, that really needs to be addressed. So if you want something that isn't philosophical or conceptual, something that you can touch and feel that you could make a recommendation about, I would strongly urge you to do that. And we're very good here in Ireland about human rights. We have a history of it. It's in our DNA. So I suppose I'd ask you to get on board and help us with that. Thank you very much.
And Bríd's colleague, John Bennett, from a local drugs task force, is going to use up the rest of Bríd's time. And thanks to Brid for being on time and some very clear recommendations. And thanks, Brid, for the call out of some of the workers in this sector that don't get the recognition, what they do for society. Over to you, John.
Hello, everybody. My name is John Bennett, and I'm the chair of the Local Drugs Task Force Coordinators Network. And I suppose I was just listening to Eamon there, and I was just reflecting on the fact that I grew up in a block of flats in the late 1970s when I suppose the heroin problem would have started. And I suppose there was no services, there was nothing. And I suppose the peer group I grew up with, I suppose we spent our evenings playing with syringes, squirting blood at each other, and developing all sorts of illnesses that we didn't know of and nobody knew about at the time. Things like hepatitis C and things like that. Medical science they weren't aware of the transmissibility of that. Hepatitis A and B they were. And I suppose in the context of that, starting off from that position and sports having grown up coming from that background, and seeing all the pain and the hurt and whatever. I remember a young man named Bernard Lee, and when it struck home to me first when I realised the seriousness of it as a teenager, who came home from work one Friday evening, and he went into the bathroom in his small flat, and his parents and the rest of the family were having dinner. He went in, he injected some heroin, and he died in the bathroom. And, you know, the family went in, discovered him there, and it was like one of those things that when you're young that never leaves you and you never forget, that something as mundane as coming home from work, going into the bathroom, and this was a young man that was working, you know what I mean, and nobody had any real understanding as what we were hit with at the time, and what was coming down the tracks later on in terms of HIV and all the other problems that emerged later, and the serious organised crime that emerged later in the communities that I'm going to talk about. I think it's also important, though, to sort of, as a backdrop, it sounds very down and depressing in some ways, but I think what has happened, and the good news story, I think, that has emerged from Ireland here, is that since 1997, when we realised with the first ministerial report on measures to reduce the demand for drugs, otherwise known as the Rabbit Report, which some of you might have heard of, I suppose some of us were called into the Department of Enterprise and Trade. I think Pat Rabbit was the Minister for Enterprise and Trade and Employment at the time, and he invited some of us in that he knew that were working on the ground in communities into his office, and he said, what the hell are we going to do? This problem is just getting worse and worse. There seems to be some interest in government, across government, to do something about this. And what do you think we should do? And it's interesting listening to Eamon there a few minutes ago in terms of the Taoiseach and the Department of Taoiseach. That's exactly what we asked them to do. And that's exactly what happened at that time. The Department of the Taoiseach set up a committee on drugs, social inclusion, and local drugs task forces, regional drugs task force, all the wonderful, wonderful programs and projects emerged out of that from that time. And I suppose, sadly, along the way, we sort of lost our way in some ways in Ireland. We set off in the right direction. That was all built on the knowledge that we had built up with through the local development partnership companies, who were also linked in with the Department of the Taoiseach. Remember, we had mass unemployment back in Ireland in those days. And there was an interdepartmental committee chaired by the Taoiseach to oversee a lot of local community responses to unemployment at the time, So that model and that approach was adopted then. And I suppose that in a sense is, I suppose, where I'm coming into this today in terms of what I want to say to you is that in some ways we've gone back in Ireland in recent years. We had a lot of the stuff that I heard, you heard guys here talking about from Portugal and Austria and all that type of thing. We were heading down that road many, many years ago in this country, like at least 15 years ago, but we lost our way, Unfortunately, we lost our way. And I think there was a sort of a sense in this country that, the partnership approach is somehow gets in the way of some of the, I suppose, bigger statutory agencies getting on and doing things. Why do we have to bother with this? Why do we have to go through this? Why do we have to even talk to these people sometimes? I got the sense anyway. And it's great to hear Eamon sort of advocating now that in some ways we go back to that. We go back to the department, this being led at the top by the man or woman in charge at the top, and is given the political priority that it needs. Okay, and I suppose if that's the message that Eamon is advocating from the HSE, and that's something coming from the ground in terms of the local drug and alcohol task forces as well. It's something that I suppose a key message that I'd like to hopefully get across to you here today in terms of what do we do about it. Like Pat Rabbit called us into the Department of Enterprise, what the hell do we do? And if you ask me that question, that's the keystone, that's the starting point, because we've developed over the last 20 years a massive amount of really extraordinary skills and abilities in this country around dealing with the drug problem. And but the problem is that using the I suppose a medical analogy.
Just 1 minute.
Yeah, using a medical analogy. And the key message, I suppose, the final key message I'd like to leave you with is that, we over the last, since 1997, we've figured out what works in this country. We've figured out the good practice. We have fantastic training programs in universities and colleges around drugs and alcohol and various different initiatives and that. There is a sense from schools, from guards, from teachers, probation officers, social workers, that they all have a role to play. Ordinary people, ordinary parents, we all have a role to play. But the problem for us, I suppose, in our local drugs task force areas, the intensity and the concentration of the problem in our areas, okay, is such that there isn't enough to go around there isn't enough support to go around to give it. And
Okay, John.
using the medical
John, I have
analogy,
to wind you up. Sorry.
we have a medicine that works, but we haven't got enough of it to give to all the patients. We have a medicine that works.
Okay.
We don't have enough of it to give to all the patients equally. Thanks.
Thank you, John. Thank you.